I think certainly the current system seems to be inadequate or inefficient.
Certain projections actually say that by the year 2050, healthcare spending could potentially be 50% of our nation's GDP.
We know, particularly from European countries that are far ahead of the U.S. in using information technology to improve health outcomes and reduce costs, that there's high potential for the utilization of this kind of information technology to ease the stresses in the cost increases in our system.
The time to get involved in your health care is not when you're sick. And so what you want to do is make sure that all this information is portable, because if you get really sick, then you would have to move from doctor to doctor.
I have many hopes that using the technology to get their health issues with my families will improve the quality of the services that they receive.
We've grown up in a technology-enabled environment, information-sharing environment, and we've seen the benefits of it.
My expectation is that we will get to a point where we have an electronic value chain that includes healthcare providers, payers, and of course the ultimate consumer of the healthcare industry, us, the citizens.
The idea is that everyone would have an electronic health record.
An electronic health record is information about you, your health care that you've received from a healthcare provider. It is operated, maintained, stored, created by that healthcare provider.
So my expectations of how health records should work moving forward, I think are extremely high, and I think for our generation, and certainly the generations that are coming up behind us, their expectations are even going to be higher.
The younger generations are less patient with waiting for records, waiting for the computer screen to come on in the morning.
Once you introduce information technology that many different systems have access to, it raises the core questions about privacy.
Privacy is not an easy issue to resolve. It's, people have very specific ideas and they can sometimes differ.
In the hospital, they should know about what kind of disabilities and what kind of issues our children have. But on another hand, I really want to know, as a mother, how they are using that information.
There may come a day when if I have something particularly sensitive, that I might not be so comfortable with even my insurance company knowing, that I have, seen a mental health provider, for example, or that I, had a positive test for a certain condition that is, potentially sensitive.
Government doesn't have all the answers, but what we can do is use this technology to find better ways to provide those services.
You still have privacy concerns, but as long as it's properly managed, which I think the government can do that effectively.
The VA system could be a starting point for other systems to look at in relation to how these records are electronically put together and how the whole system works.
HIPAA is a federal rule. It's the Health Information Portability and Accountability Act. It is a federal rule that for the first time protects patients in terms of their personal health information. And it not only protects their health information, but it also gives patients for the first time the right to request information about their health care.
We need to have some very clear rules about who can access this information and how they can use it and for what purposes. So, for example, it's okay to use my information for my health care, and it's not okay to use my information without asking me first to sell me a product.
There are some organizations who have come into the healthcare space recently that handle personal health information and are not covered by the HIPAA rule.
I think a public-private partnership perhaps takes the politics out of it to some degree and allows us to work together sort of for a common good.
Finding cures faster and quicker.
this is a great opportunity to hear from people across the country about what their concerns are.
This is an opportunity to create change. This is an opportunity to share your ideas.
What's more important to anyone than their health?